ECO7 is a native, genetically non-modified, non-pathogenic melanoma cell-adapted RNA virus of picorna virus family, enteroviruses, genus human orphan type 7 virus. That is why we call it ECO7 virus. Genetically not modified. We know that a lot of our things around us are genetically modified. It is a big question what will happen with these genetically modified organisms in the future. Because if they were once modified, what will happen after certain circumstances in the future? ECO7 is non-pathogenic in the sense that it doesn't cause specific disease. The direct anti-tumor effect of ECO7 oncolytic virus is due to its oncotropic and oncolytic properties. ECO7 stimulates humoral immunity as well as cellular immunity, and it has been shown that maybe it has some impact also on the apoptosis mechanisms. The best response of ECO7 is expected when used at early stages of the disease. Prophylactic, or what we call adjuvant, and low overall tumor load. It's interesting that after surgery, when the huge tumor mass is taken away, people are usually given chemotherapy that bites down their own immunity again. In this case, viruses could be an option that could be given immediately after surgery, either alone or in combination with other treatment options like radiotherapy, like chemotherapy, like immunotherapy, other types of immunotherapy. Up to the collapse of the Soviet Union, we have gathered material mainly on melanoma, and it was insufficient to registrate ECO7 virus also for other solid tumors. But a very helpful hand for this reason is what we call off-label use. That means that we are using a registered preparation for other purposes, for other indications, in other doses, in other age groups, and so on and so on. And so far, we have gathered a very big experience in using ECO7 viruses both for treating different other solid tumors, like gastrointestinal tumors, prostatic cancers, different brain tumors, because this picorna virus is very small. It goes easily through the blood-brain barrier. It's very important, and certainly we can't cure a huge brain tumor, but after the operation it may be very, very helpful for the virus to work on these type of tumors. Also, virus therapy has been effective in treating different sarcomas that are very hard to treat tumors, and we have used also for breast cancer, for gastric cancer, for lung cancer, but you should always keep in mind, the bigger is the load of the tumor, the effect will be less pronounced. Although I personally have experienced a really fantastic effect, even in a case where I even didn't expect it, nothing of that type. And that is why we usually say, okay, this medication is not registered for treating, let's take cervical cancer, but I personally have good experience with this type of cancer. Why not to use, especially in the situation when the person has no other options? Why not? Because it is affordable and it is very well tolerated and safe for the patient. As an oncologist, I do see the future of ECO7 virus as one player in this whole group of actors, what we call cancer treatment. And I suppose because of its low toxicity, of its affordability, it should become an important player in this game, as in combination with other treatment options. Sometimes I have seen personally myself, I have experienced a very good example of oncolytic virotherapy just alone after all the conventional treatment has been used already, and we see a really good result. A very small tumor shrinkage, but a very good quality of life of the patient. And this is very important to explain the patient, because usually patients do wish to be cured, to be treated with all the methods they are offered. But I usually start, whenever I meet a patient with far advanced cancer or even metastatic cancer, I usually explain then, I'm sorry, we are not able to cure your disease, but what we are really able is to prolong your life and to prolong a qualitative life. And in this aspect, oncolytic viruses could be a solution.